Welcome to our panel today. I am Leanne Kaler, and this is another ethical theory times practice panel. This is part of a series that we have in the School of Advertising and Public Relations. Today's panel is called Diverse Audiences, Media and Messages in the Age of COVID and Beyond. The purpose of this series that we have put together starting this semester is to bring together researchers in the Moody College to talk about the research that they're doing, and then to bring in practitioners to talk about connections and students to talk about connections that can be made between the research that's being generated within the college to just the practice that's taking place in advertising and public relations. We see some really important connections that are happening, and we want to celebrate those connections and really make them clear to students, faculty, and practitioners. And we find that these panels are a really good forum for doing that. So let me do some introductions. Our theory panelists are UT professors, and you can see the names right here. We have Sean Upshaw, who is, I don't know if the cubes are visible in the same order that you have them. They're probably not, that I can see them, but Sean, if you could just wave your hand. There we go. We have Sean Upshaw, who will talk to us about his recent work on Black newspapers as key disseminators of information about COVID. So any students on this webinar who study media, there's going to be some really important things for you to think about there in terms of really looking to diverse media when we talk about media plans. Dr. Deena Kemp, Deena, if you can, Deena will talk to us about her work with underinsured Hispanic women and breast cancer. And so we'll be talking about messages and what resonates in those with those audiences. Dr. Adrien Sebro, Adrien, if you could wave your hand. He will talk to us about his work with the renaissance of content related to Black livelihood on content streaming services and how that ties to Black Lives Matter and COVID specifically and the pandemic. So again, really exciting information related to media and thinking about channels and just lots of really important content here in this panel today with all three speakers as we think about ways to address diversity and equity and inclusiveness in the messages that we create. Our practice panelists, who I'm also going to refer to as our respondents, we have Megha Desai, and she is the president of the Desai Foundation. We have Corey Atez, who is a Texas Immersive student. And we have Dr. Amber Chenevert, who earned her Ph.D. here at UT not too long ago. And she is Group Director of Strategy and Insights and Culture Studio Lead at VMLY&R in New York. And from what I understand, Megha and Amber, you're only a few blocks from each other right now in New York.
Yes, probably ordinarily. I have to be all the way in Brooklyn, like way far deep.
Oh.
But in an office perspective, for sure, yeah.
Oh, that's funny. Okay, so let's go ahead and get started. I am so excited to hear what everyone has to say today. So I think the first researcher or theorist that we're going to hear from today is Sean. So Sean, if you could share with us what you have to say.
Can everyone hear me? Great.
Yeah.
Okay, perfect. Okay. Let's see. All right. Good morning or good afternoon, wherever you may be. My name is Sean Upshaw, and I'm an assistant professor here at the University of Texas at Austin. And I'm here to present my study is looking at COVID-19 in Black newspapers. As many of us, COVID-19 has definitely changed the way that we not only see ourselves in the midst of a pandemic personally and as well as culturally, but the way information is distributed and also the implications behind the lack thereof or insufficiencies surrounding prevention and self-reporting and characterization of COVID stories, particularly for Black and Brown populations, particularly for African Americans. The disproportionate rates of infection and as well as death, unfortunately, continues to be a disparity problem. So with that change or that challenge of understanding how narratives, visual narratives play a role in dissemination and reception of COVID-19, my goal was to simply look at the ways in which diseases are characterized and also recommended in terms of how to navigate COVID-19 for Black and Brown audiences through the lens of Black media, particularly for those who are interested in Black newspapers or the Black press. Theoretically speaking, my study mostly uses a qualitative content analysis, but it's in the neighborhood of framing. So for those who may not be familiar with framing, it is a strategy on how individuals make sense of everyday life. It is socially constructed, and it does guide one's interactions and assessment of everyday life through situations of visual narratives. So in other words, when things are framed, you can think of it as a package that is all put together and presented to an audience that is sort of encourage individuals to think, feel, and respond to the narrative through everyday life situations and those that are in it. So my findings came out in multiple areas. First, when it comes to characterization messages, obviously is considered, or at least COVID is considered an extended health disparity, dealing with prolonged access to healthcare options, resources for Black Americans during the pandemic, and also is a recall of racial barriers and trauma for Black Americans that the trust system, the access, and the narrative surrounding disparities, resource lacking, and much more, sort of cater to how it is framed or packaged in stories from members of the Black press or media conglomerates that also kind of shows us how people are feeling. And in the flip side, what are some recommendations that these particular outlets are reporting or telling their audiences to consider? Well, for one, testing, obviously it is a big thing, but sometimes it is under promoted. And most importantly, however, I would say that hygiene practices, sanitization, and social distancing receive consistent promotion over testing, which kind of tells us that there's a little bit of a gap in terms of trust and resources that Black Americans should consider in order to navigate. And one of the things I wanted to point out is that this pandemic will continue to evolve for years to come, especially for the bracket areas of health disparities going forth for Black Americans. And particularly, my contribution to this particular study highlights cultural relevancy of health information as a vital feature on how Black newspapers can save lives, incorporating strategic elements of social marketing for future engagement and resources for underserved populations. And these are my references. Thank you. I think I beat the time, Leanne. So thank you.
You did, and one of the things I wanted to summarize for that is you talked about historical relevance, right? And having read your work and talked about it with you, I wanted to highlight one of the things that you didn't have time to really elaborate on, and that is the point about one thing that Black newspapers can do that other outlets don't take the time to do is to really contextualize why some of these information barriers might exist, or why, for example, testing isn't promoted as much, or perhaps maybe even receiving shots might not be promoted as much. And that is that medical mistrust because of mistreatment historically of Black Americans by the medical establishment. And there's lots of historical records about that, right? And so the mistrust is earned, right? And so Black newspapers will take the time to recognize that and to sort of sit with that. And then, and with that recognition, there is I think there is more earned trust. And so if the medical establishment could partner with Black newspapers, there could be an overcoming perhaps of that mistrust by recognizing here are some of the barriers. And so I just wanted to sort of bring that up.
Thank you.
Okay, so let's move on to Dr. Kemp.
let's try that again. Good morning, everyone. I'm gonna try to share my screen one more time. Can everyone see that? Great, okay. So I'm excited to be here to talk about a project that I've been working on, honestly, since a week before the pandemic officially began and we all went into lockdown. The formal title of the project is Advancing Breast Health Among Uninsured Women. What that really means is that I work with a team of researchers, UT researchers primarily, but also clinicians out in the community, to find ways to increase mammography screening rates among uninsured women in Austin and surrounding counties. And to also make sure that for women who may get a screen that indicates that they do have breast cancer, that they have adequate support going forward in order to receive the treatment and care that they need. And so we literally received word that we'd gotten funding for this grant a week before we went into lockdown. And so this wasn't intended to be a COVID study, but we did have to take COVID into consideration in the work that we've done. And we're about a year behind in actually getting the bus that you can see in the lower screen here out on the road. But the idea behind the project, and I kind of took the first leg of the research, is to understand the needs of women, and in this study, it's predominantly Hispanic women, but it's not only Hispanic women. The reason that it's predominantly Hispanic women is that even though 30% of the state, approximately 30% of the state identifies as Hispanic, about 40 to 60% of uninsured individuals, right? So that's a real health disparity issue. That's one of the goals of this project to address. And because of being uninsured and other issues, sort of issues of inequality within our healthcare system, these women also tend to have lower rates of screenings. The project is particularly focused on women between the ages of 50 and 74. The research that we did in the first phase kind of showed to us that we should be focused on women between the ages of 50 and 64 because women over the age of 65 tend to have Medicare, which actually seems to provide really good insurance coverage. And so we're really focused on this age range because they are at higher risk of breast cancer due to their age. And so the first leg of the research, the work that I've been doing, was launching a survey among Texas uninsured and underinsured women in that age range. And it's loosely based on the health belief model. If you've never heard of the health belief model, it's really a way of understanding how to communicate with people and persuade them to take steps to protect their health based on what they already know and what they already do and their attitudes towards the health issue at hand. One of the things that was important to us is that we wanted to look at having both a Spanish and English version of the survey. And so it was very interesting, the process of working with a firm to translate the survey, and then working with people who were sort of native, everyday, primary language spoken in their lives to make sure that that was culturally accurate and would be understood in the ways that we intended it to. We had about 400 participants, 71% of whom had no form of insurance. The other 30 or so percent were underinsured. They didn't have sufficient coverage to get a mammogram or to get the follow-up care that might be needed. We found that about 20% of women had been screened in the last 2 years. That's really low. And 20% had never been screened at all. But one point of hope was that 60% of them said that they were likely to get a mammogram in the next year. And so we saw that there was some intentions, and one of our goals was figuring out how to convert that intention into behavior. And so part of the health belief model is looking at barriers. What are some barriers that are preventing people from enacting on their intentions and actually following through with the health behavior in question? And we found that cost was the #1 barrier. And that's good news because the project is designed to increase access, to give women access to free mammography. But we also found that there were some barriers not related to cost at all. So one of the biggest fears, particularly among Hispanic American women, was fear of pain. They'd heard that it was painful or they'd had a mammogram themselves. And so I have a quote here. It's a direct quote from one of our participants. When we asked them what they knew about mammograms, this is what one participant said. There were also women who were afraid of finding out that something was wrong. And so that could be because maybe they were afraid that they'd be abandoned by a partner or that they wouldn't be able to take care of their family. But there could also be the fear that even if I know, I can't do anything about it because I don't have the resources. One thing that I think is really important from thinking about this in terms of culture and equity is that some of our researchers went in thinking that there might be beliefs about witchcraft, for instance, or beliefs that if you got cancer, you were being punished, and that those may be barriers. And so we wanted to ask about that. And for me, it stood out that sometimes we have beliefs about audiences that are just way off the mark. And these were two things that were really way off the mark with this audience. Virtually no one responded to these items. In terms of motivators, free, right, rose to the top. Finding a lump, though, was really concerning because for many women, by the time you find a lump, it's too late. So that was the key message point that we needed to focus on. And that having their physicians refer them was one of the biggest ways to ensure that they would actually go follow through with a mammogram. This was concerned about mobile screening. And so mobile screening is really attractive, we found, particularly during COVID, when people may be afraid of going to hospitals or clinics, et cetera. And that equity messages really resonated more than privacy or comfort or quality of the equipment in the mobile unit, that knowing that this was a service that made mammograms available to everyone, regardless of their ability to pay, was the most attractive feature of the program. And so in terms of how do we now take this information and think about turning it into messaging that can convert that intention to behavior and increase awareness of the service in general, thinking about letting women know that waiting to find a lump may be too late. Mammograms can detect breast cancer before they detect a lump. That the bust isn't designed to give access regardless of ability to pay. Leveraging social behavior, there we go. Leveraging social behavior. I actually took this research to my campaigns class. So I've already had students involved in this and had them involved in a brainstorming session. So that pin that you see on the bottom, there's a student idea about having physicians have these pins in places like People's Community Clinic and other places that provide support for the uninsured, so that patients can have, or even if their physician isn't thinking about it, the patient can actually initiate, like, what's the big pink bus? And that would be a trigger. So that's the research. I'm looking forward to you guys' questions on other aspects of it. Thanks, Leanne.
Excellent. Can you just redefine for me what you mean when you said equity messages?
So equity messages, we had messages about ability to pay, right? That the service would be available to people regardless of their ability to pay, that it would be available to them regardless of their social status, et cetera. And those messages resonated not significantly more in terms of, like, you know, 4s versus 5s on a scale, but they rose to the top compared to things like the quality of the equipment, or the where there was all female technicians and other things that past research has suggested were issues for mobile screening clinics compared to fixed locations.
Yeah, excellent. So there's another thing I want to highlight. There's a couple things I want to highlight here, and I put them into the chat as well. I want to highlight how important demographics were as you were laying out the study in the beginning. Students learn about demographics and psychographics in a lot of their introductory classes. I want to also highlight that you talked about converting intention into behavior, and I just wanted to highlight for students that obviously that is one of the key goals for all practitioners, right? to convert intention into behavior. And then the other thing that I wanted to highlight is I wanted to make sure that we sat with that point that you made, that a lot of times people go into and assume that they know a barrier. Particularly if it's a barrier about a group that they're not a part of, but they think that they understand. And so in this case, it was that they might perceive witchcraft or something like that. And they went in thinking they thought they understood this barrier, but that barrier did not exist. And this is another reason why it is really important to have diverse teams that really do understand and identify with and have the cultural background to connect with the audience that you're seeking to understand. So, all right, excellent. So, so you can unshare that screen and we will move into Adrien.
All right, just a moment. Let me share my screen.
Yeah. And your dog.
Yes.
And your little dog too.
All right. Okay, so my work is called Streaming for Black Lives, and largely this work was important to me, definitely in this particular period, because what I try to do in all of my work, my classes, my writing, is to make it clear how much media is a political power and how much media is a reflection of the moment in which it's produced, right? And going back to when I teach about films and television shows in the 50s to present, all of them reflect the time period in which they were produced in certain ways. So what I was doing in this project was really talking about this idea of how now the SVOD or subscription video on demand services really control how we view media, particularly television and film. And presently kind of this, there's no need for, cable connection for in-home viewing. So really this dominance of subscription-based programming is really kind of changed a lot of trends in which people, particularly in the US, consume media. And so in tune with these changes and trends, this phenomenon has brought about new forms of also like Black cultural production and the means in which these culture makers tell their stories to the masses, especially with the overwhelming majority of media platforms being white owned and operated. So what I got from that moving forward was thinking about how it is that various media companies, specifically SVOD companies, respond to particular cultures. And along with that came this idea of like, how is it happening during, a time of COVID? So through COVID, we saw the streaming services sales went up about 50% during this era of particularly largely around, this April to about, August of last year, at the height of kind of the stay-at-home orders. We saw this extreme rise in subscription video on-demand programming, as well as content being pushed out because of, stay-at-home orders and everyone really hunkering down in their own homes, the way films were released instead of going to theaters, things like that. So we saw streaming services up. But along with that, and happening in 2020, along the same time period of this, pretty much February through July, you also saw police brutality and multiple murders of Breonna Taylor, George Floyd, Ahmaud Arbery, and many other Black people across the nation. So what I wanted to do was also thinking about with all these eyes on these streaming networks now, how are they responding to these mass murders and police brutality? And particularly, how have certain companies that I studied in this particular work, Netflix, HBO Max, and BET Plus, how they mobilize their platforms to respond to racial injustices through various strategic methods. So how have they marketed around it? How are they talking about it? And these responses, some more than others, have worked to reconstruct how their platforms exist as sites for telling Black stories, educating on racial injustice, and providing escapism in a time so fraught with violence and Black pain. I think this is so important because, again, it addresses how much of a political power the media has and in constructing culture and society as well. So how are these major platforms responding to these injustices was really important for me, and how I feel as though like people are going to consume and learn about injustices in Black history. And we saw these programs take different methods. We see here from Netflix, they had this post from Twitter come out, as well as the one on my title screen come out regarding, in support of Black Lives Matter, saying like Black storytellers matter as well. So along with that, you also saw this I believe it was on June 10th of 2020. If you open Netflix, this was the opening screen, right? It was saying that kind of this is more than a moment of saying Black Lives Matter. Where this is Netflix saying that they are, doing everything in their power through their staffing, through their series of films and television shows to talk about Black lives, to educate on Black lives through content, right? And this led to them having many categories of showing Black content, Black superhero content, Black comedy, Black television, Black history. And you also saw this kind of larger wave of Black sitcoms from the 90s come out as well too. It was their way of kind of overloading in the Black content that people were seeing on Netflix as a way to kind of answer to and making a reality of how Netflix is going to respond to Black Lives Mattering. We also saw that in HBO, it took a little different route. Outside of just content, what they did was they claimed solidarity with Black Lives Matter, but what they also did was kind of take away certain films that were part of their platform and reintroduce them with more content around the historic specificity of these films such as Gone with the Wind, right? And what they did with Gone with the Wind, kind of it really is heralded as kind of America's, if you put cost to inflation from 1939, it is the most watched and the most paid for film in American history. So with that and the racial overtones of this film, HBO thought it was best to remove the film and then bring it back with more content and an introduction on the history of why this film was important. Although it may have, you know, some racist overtones in the space of 1939 and the kind of the entirety of the story around the Civil War, they added history to it, and they added, like, you know, symposiums and talking about what kind of this complicated history of Gone with the Wind as a way of adding content as well as education to the history of the film, and why, although this film may have, you know, a history of, you know, uncomfortability, it is important to reflect on the history of, like, what you can see the history of America through this film, right? And I would say what kind of lastly what I looked at is BET Plus as a platform that already is on the basis of talking about Black culture, Black society, Black history. BET took a different route in you know, talking about Black Lives Matter and this whole movement regarding, you know, Black livelihood, because rather than taking just a content and a education approach, they aligned themselves with Black Lives Matter, the movement, rather than just the moment. Like looking at HBO Max and Netflix, they're more so aligned with the moment of Black Lives Mattering and pushing content through that. While BET, as their roots are in, you know, visualizing Blackness on screen, they brought more content, as well as show their full support alongside showing the movements on screen with Black Lives Mattering, as well as, you know, producing a new series called Justice Now, a 9-part series talking about different forms of historical injustices of Black Americans. And they also, you know, also added various films and documentary specials like Katrina 10 Years Later, Rest in Power, the Trayvon Martin story, and the show called Finding Justice. So what they did differently, each of these networks really utilized this space of kind of Black Lives Mattering amidst the kind of the murders and brutality to really in some ways commodify you know, Black death and Black suffering, but also working to educate and to, you know, enliven people around the injustices going on with Black people across America. So I thought that was so important, again, because with the media, having so many faces on screen in this moment, realizing how the media is responding to these injustices is, and realizing that going forward is important to realize how what's at stake with these media production companies, how are they going to respond to issues moving forward? And I would like to also kind of compare that to how they might respond to issues moving forward, present day, with, like, you know, with regarding Asian hate, right? How would media move forward with that? So looking at these various ways in which these media production companies, they have such a political power, holding them accountable to how they're utilizing that power and in what ways. And that is all for me. I'm trying to exit.
Excellent. I wanted to highlight this idea of commodification that you brought up. It's something that we talk about in my psychology of advertising class, that there's two sides to it, right? That we're elevating stories, but at the same time, it's not out of goodwill.
Oh yeah, it's a business above all.
Yeah, these stories sell, and it's the same on the advertising side as well, that these brands are aligning themselves with these stories and with these causes because these causes sell shoes, or, you know, they sell whatever, sports equipment, or so I mean, we'll take it, but, you know, we have to be honest about it. So awesome. All right, so those are our 3 researchers. I want to remind students that we are dying to also hear your input. We can't see your faces because that's just the way these webinars work, but we know you're there, and we want to hear from you. And so please feel free to show you're alive in the chat or in the Q&A, and we will respond to you. Also, the Q&A is just down here. If you haven't done one of these webinars before, the Q&A is a little icon down at the bottom here. Okay, so what we're going to do now is we're going to pivot to our respondents. Our respondents are, we'll start with Megha, and we will ask you to just, you can respond to anybody or anything. And just, this is a very organic conversation, anything you want to talk about, and we will just take it from there. You're muted. There you go.
Hi guys, thank you so much for having me here. Hi everyone. Thank you guys so much for those presentations. It was really, really interesting to hear so many different perspectives on when it comes to inclusion, especially around messaging. We at the Desai Foundation empower women and children through community programming to elevate health and livelihood. And one of our main programs is around menstrual health. And what I really liked, what Dr. Kemp, what really resonated with me, what Dr. Kemp and Mr. Upshaw were talking about were around the barriers and stigmas that often need to be shifted in order to accomplish your goal, right? So if your goal is to accomplish, getting women to get mammograms, or it's to change the stigmas around getting vaccinated or tested or wearing masks. It's always really interesting for us, at least, to look at what these stigmas are rooted in. For us in menstrual health, the stigmas that we're dealing with are centuries old. And these centuries old stigmas, believe it or not, were actually rooted in something good. So originally back in the day, women were told not to work and cook and fill the water when they were on their periods, not because they were dirty, but because they were bleeding and needed rest. But somehow those stigmas have been twisted and turned into the oppression of women and made it so that they now are unworthy of God's love and aren't allowed to cook and aren't allowed to enter the home. And what it does is created this whole health crisis of women not using proper, not knowing anything about their medical health or having access to sanitation. So that is something that's really, really resonates. And what we've been trying to do is chip away one by one, using not only kind of awareness methods through media, but also on the ground with hand-to-hand combat. I think that media can play a really powerful role, but I think what it does is really, I think for me, what I've noticed in practice is the media helps a conversation begin. It's the hand-to-hand combat that changes minds and converts people over. So it's creating those, for lack of a better term, missionaries that go out into the community. And once that media is starting to sink in, then having that bottom-up approach and really making the conversion. And so it was really interesting to me to hear. I was quite surprised to hear the reasons why. I would have never thought that this like pain was a barrier to entry. That to me was fascinating because, similar to the stigmas in India, people are like, what do you mean you can't touch the pickle? What does that even mean? And people don't truly understand where these stigmas come from. And so I hope that was helpful for us. That was this really kind of bottom up approach when it comes to barriers to entry and stigma.
Cool. Deena, do you want to respond at all?
I was thinking about your point on hand-to-hand combat, and I think that's one of the things we're working with is how do we find, we call them message amplifiers, people who are in the right places and have contact with the audience that we don't have in relationships, right? The women who aren't afraid of the pain, how can they be support to the women who might be, right? Can we get them to sort of have the social partnership? So yes, definitely resonates in that way with me.
Yeah, totally agree.
Mm-hmm. Sean, did you want to comment on that at all?
I guess when looking at the construction of messaging surrounding both the cultural and science of an issue, it definitely takes into consideration language and representation and history surrounding the complexities of the topic, and being able to provide sort of a customized approach. So I'm using customized very, very loosely here because depending on the audience, the mindset and or belief systems that are already in place, having that type of approach strategically will help audiences have a better understanding, not in terms of what you're thinking is wrong, but here's another way to think about it. If I were to provide another perspective that will help people to see it's basically a universal approach to looking at a singular topic from multiple ways of understanding. So it definitely resonated with me when you mentioned those perspectives.
Yeah.
Yeah, sorry.
Just one really quick note on that, because I love both of them kind of said something that really speaks to me is you're both exactly right? It isn't a one-trick pony. It's not just going to be through messaging, right? It has to be through access. Like, how are they going to have access to the menstrual pads, and then it's all these actually also secondary access points. One of the reasons why people don't use sanitary pads in a lot of communities in India is because there are no toilets for them to change them in.
Mm-hmm.
And so sometimes it's not as obvious what that barrier to entry is. And so I 100% agree with you on that, is learning what the message is and then understanding kind of on the ground what those other barriers are. So I really appreciate that.
Yep. I was also thinking the finding the authentic channels, if there are channels, right? So the Black newspapers, oftentimes all white teams don't think about, they dismiss these channels outright. I don't even know if we in our courses talk about these channels as part of the media mixes. And so, and there's just a really high level of authenticity and connection with those. They're much closer to that hand-to-hand combat. And they're free often, almost always, right? Is my understanding. Sorry, okay, yeah.
If I can just add one more thing, I didn't focus on the fact that we did have a significant share of respondents who were African-American or Black participants in the survey. And one thing that stood out to me in looking at sort of differences based on race and ethnicity was, I know that there's been a lot of work, right, in African-American communities and churches to push this message about breast health. And that was sort of evident to me in the fact that past behavior was higher with this audience in terms of having regular mammograms, having had them in the past, being more articulate also in what a mammogram is and why you need one. And so I thought for me, that was evidence of how the combination of factors over time can start to show rewards, and where you see those intentions and that awareness actually manifest in not just behavior, but a community norm around this is what we do in regard to this issue because we've taken ownership of it.
Yeah. This is so awesome. I'm really enjoying myself here. All right, Corey, let's see what you got. What you've been thinking a lot. I've been watching you thinking. What are you taking in here?
Yeah, I really liked everyone's research. What really stood out to me, I mean, from each researcher, everything almost stood out to me, but I just want to talk about certain points.
Yeah.
So with Professor Upshaw and Dr. Kemp, I kind of like the subject and the idea of kind of how, I guess, trauma and past trauma and just language barriers make communities kind of resistant to healthcare and resistant to trusting people. I kind of think of my my grandma and how she was resistant, just go to the doctor to go help with her cancer, and kind of when she didn't go to the doctor, it was kind of too late. I just kind of think about that, and within the Black community, I kind of think about that with the HIV and AIDS epidemic, and how kind of the media kind of demonized the Black queer community, the Tuskegee experiments, which goes back to Black people's resilience to not getting, shots and just medical examinations. Literally the whole field of gynecology was just experimentation on Black women. And just there's also just today higher child mortality rates with Black women as well. And so I feel as I progress in advertising and become in the professional field, I feel like more advertisers need to be in community with more of these marginalized communities. And I feel also just going to UT in general, a lot of people they'll read books about Blackness or Hispanic culture and just other things, but they don't really actually talk to them. They'll read all the books, but they don't really actually do the work and actually speaking with them and understanding them. Because when you do research, we Black people and other marginalized communities, we're actually people. You can't just survey people, just actually need to talk to people. So that was the main thing that kind of stood out to me. And then also with Professor Sebro. I don't know if you remember me. I took a class. I really liked your class. What really stood out
Of
to me
course, I
was,
remember you.
yeah, what really stood out to me was the commodification. I also think about how Breonna Taylor was treated with like a bunch of brands. I just know, just I don't know, she just wasn't really like treated, I guess, equal to like, I guess, George Floyd. Like they would just say Breonna Taylor's name just to say it, and like, just as you were saying, commodify it and not really like take it seriously. It would almost just be a trend that these brands would use. And what I also liked within your research as well was kind of talking about how Netflix has, you know, these Black Lives Matter section. HBO did something with Black Lives Matter as well. And then also kind of with Netflix, I do like the like Black Lives Matter section, but like also like predominantly like a lot of their television programs are like mostly like light-skinned people. They don't really feature a lot of dark-skinned people within their like television programs. So I think that's an issue that they need to combat. So yeah, that's pretty much all I have for that.
I'm unmuting you, Amber, because I feel like some of the things that Corey was talking about, I felt like your eyes lit up.
Yeah, I have a lot to say, but I'm gonna try to keep myself together.
Oh, come on, why?
Wow, because I, I work in industry now, but I still have that PhD, like,
Yeah.
like I go.
Speaking of PhDs, I'm thinking Corey might be working his way up the graduate school.
Oh yeah, Corey, go ahead and let Dr. Kaler reel you in, because she would have been, you would have been the first that she pulled through all the way through. But first of all, I just have to say thank you, Leanne, for the invitation. Y'all don't know that Leanne was on my committee, both my coursework and my dissertation committee at the University of Texas at Austin, and she saved me from many a bridge because I was quitting every semester. but she helped keep me on track. So I have to say thank you. Professor Upshaw, Dr. Kemp, and Dr. Sebro, your work is amazing. I am definitely enamored, and I thank you for your contribution to the field, and also your willingness to spend time with folks like me in the industry to sort of keep us thinking about like what's really important when it comes to connecting to customers. Sean, as it relates to your work with the Black newspapers, at least on the agency side, I work at VMLY&R in New York. We're a global marketing, communications, advertising agency. We are presently going through our own transformation within the company to help us to think about how Black lives matter to us in every aspect of our business. And in doing so, part of that is thinking about where we help to advance media dollars towards Black media, and then also multicultural media as well. So this idea that you brought up in your research as it relates to framing is something that's so useful in how we even frame importance in media buys, and what that means to how we connect to consumers. I'll also let you know that it is also, Leanne might know this, framing is one of my favorite theories. So it also informs how I'm encouraging people to rethink even about their research and their segmentation when it comes to framing research and segmentation, and how much that impacts outcomes, how our creative looks, how we begin to go in the marketplace. So that was just super inspiring, like that particular work. Dr. Kemp, the breast health work is so amazing. At VMLY&R, we have a significant health practice, and those have been the questions that have popped up. how do we better connect with communities of color who have been disenfranchised from the healthcare system? And like, what are the ways in which we need to best engage? And that idea of demystifying populations. And like the challenge for me in that space, because I do work on the health side, I work on a diabetes technology brand. And the challenge is always there are these particular myths about people and populations and who they are. And I have had to bite my tongue a little bit and say, well, you know what? Why don't we measure that variable of mythology that you're bringing to the table, and let's decide whether it's real or not, right? And all the time, it's never real. But because I've pushed for it in the research, we have data to prove that. So thank you for that. That is paramount. And I just love that idea of like equity coming to the table. A lot of times when people have sort of mythology, myth, legend about who they think people are, they don't consider that sometimes it's just regular stuff that people want. It's not the mountain, it is just to be treated fairly and to have equal opportunity. So I think that that's important to bring up. And then Dr. Sebro, for the streaming work, like, oh my goodness, there's so many things because we've all been home, especially me, and I've been paying attention, and I can't turn the research brain off when I'm looking at Netflix. It is consistent. So one of the things that and I have to confess, like I see a parallel between Dr. Upshaw and Dr. Sebro's research. So I hope that you all will collaborate on Black media and representation. I just think that would be really cool. But like the streaming piece is really interesting because one of the things that I don't have data on, but I keep seeing on my social media personally, is how people are really disenchanted with sort of this like Black trauma entertainment piece, and how that seems to be consistent across all the streaming services. Like there seems to be a hunger in the marketplace for Black people to just see Black people doing regular stuff, like going to a party, having fun, eating dinner, telling jokes, playing the dozens, playing games. But if we were to just look at media and our representation at the moment, we're either like just it's total buffoonery by way of reality television, or it's complete and total trauma. And do we, as Black people, are we allowed to be full humans? Are we allowed to have full humanity? And like, to what extent is that represented in the media, or are we just hopping on the trend? And going back, and this is my last point, I promise. This was just such a great conversation. Thank you again for having me and allowing me to sit in on this. My last thought is like from like a representation standpoint, because I also lead Culture Studio at VMLY&R, and it's a way of thinking about strategy overall and how we engage consumers from different points of interest. One being research, other being health, me being from like a foundational culture perception. So my point of view on culture at VMLY&R and how I'm leading it is from foundations. So not trends, but foundations, language, art, music, those sorts of things. But the thing that brands are coming to us and asking for is like, how do we begin to authentically connect? And so the research that you all are presenting is a good reminder, and hopefully there are other practitioners that are hearing this and seeing this, is that, grounding in culture from a foundation standpoint, understanding what it means to people, understanding what moments mean to people that are sometimes not moments, but are movements and actually affect their lives, is real. when clients oftentimes or brands oftentimes look at what's happening in the marketplace, it doesn't affect them. But when I told one of my clients that Breonna Taylor's boyfriend is my third cousin, they said, oh. I'm like, this isn't, you think that, all of this is, oh, what a shame. No, this is really happening to us. This is really a reality for us. I'm like on Facebook doing like, GoFundMes and raising money and like, listening to his aunt talk about the challenges that are like, this is really happening to us. And I'm glad I was in a space to kind of bring that to the environment, going back to Leanne's point about why diversity, equity, inclusion is so important with regard to who's making the decisions, who's pushing the effort through. But it is a fight. And for the few of us who are in the business, just wanted to let y'all know we are fighting, we're pushing, but we do need this continuous sort of research and push in academia in order to continue to push us as well, because it gives us the evidence that we need to help us fight. So that's all I had to say.
Oh, that's so wonderful. Thank you so much. There are some questions here, folks. Megha, did you want to?
I did, if I could. I'm just like so revved up and excited.
I know, right?
So, Amber and Adrien, so it's funny, I was gonna bring this up, but I didn't want to like bifurcate ideas, so I just stuck to one. But Adrien and Amber just brought up such an interesting point. In the nonprofit world, we have this thing called poverty porn. And poverty porn is when you, it's flies on eyes, it's depressing, dying dogs with Sarah McLachlan playing, it's poverty porn. And it's something that a lot of us in the industry, in fact, I'm part of a community of a lot of folks that work in nonprofit that have vowed to never, ever, ever use poverty porn. And so when you look at the work that we're depicting, you'll always see happy, smiling faces. But a great example of organizations, putting their money where their mouth is and really trying to shift that perception. One.org was a client of mine before I got into nonprofit and I was working in advertising. One of their big asks of us was, we really want to get people to shift their perspective on Africa, the continent. And, we're not trying to raise money. We already have all the money we need from Mr. Bono. We just need to figure out how to shift the perception. And so they came to us, and we were a small little boutique agency, and said, any ideas that we're game. And we came up with this idea of working with Spotify and saying, what if we did and this is, by the way, it was over a decade ago. So back then it was like this weird Swedish company called Spotify that nobody had heard of. But, it was like, let's go to Spotify and create a music channel that just portrays like the best music out of Africa, that Bono will personally be invested in curating every month. And that way you're looking at Africa as a continent, as a place of innovation and creativity and joy and music. And so it was so lovely to see the different ways of that happening. I guess my question, if I may, is what were the results of that experiment from Netflix? So if they put those things on that homepage, were people clicking in and watching, or were they not?
Yeah, so I couldn't find any, specs or metrics on like the actual results of like, if people, because what had happened was like, when you logged in Netflix, you had to see that page, right? And if you wanted to keep watching or whatever you logged in for to watch your show, you have to click like, continue to collection. Cause I think it said like a collection and it said Black Lives Matter collection, right? So like you had to choose something. So one thing they did was like, yeah, you literally couldn't enter the website without seeing that. Whether or not you care to read it or not is up to the person, of course, but that's what they did. And I think that is one great way. And I think that's kind of like any SVOD program has the ability to do that, with some, so whether or not you're going to read into or care more to think more, you're at least like saying, Netflix is like saying, look, it's here and it's directly here and you saw it, right?
Yeah.
And so like, that's what they did with that. And I think that, and I think you mentioned like diversity porn, like it's Netflix and other ones, but I'll specifically say on Netflix right now, they're really on this idea of like really diversity porn. I was talking to somebody about this like yesterday, actually, where, you know, and kind of how Corey pulled out, put into conversation, it is very much pushing like, you know, which of course is great to see representation, but it gets to a point that, all right, is it representation for representation's sake? Are you trying to tell something? Are you trying to teach something? Are you trying to build a better society in some way? What are you doing with this representation, right? So there's the idea of like pushing a lot of like interracial families, you know, biracial children, like their stories, all these things, which is great. They need to be seen as well, but are you doing it for the sake of just the numbers? I have this thing I teach students called like simulacral versus mimetic realism, right? Are you really doing like these numbers of diversity to check off these boxes, or what are you doing with these diverse images? Are you telling the actual stories? Are you getting into the histories and discussions that make people better understand these stories, right? So I think things that could be done better are in that way, like, you know, putting more emphasis on the actual story. And I think Netflix is a space that, you know, not having to rely on advertising, they're really relying on just the consumer, well, like, you know, the subscriber dollars. They can kind of put anything out there. I'm sure you log in Netflix, you see like 50 new things a day, right? It's because they're not losing anything doing that, because they already have your, you know?
Yeah. I'm curious what the results would be if those 6 shows that were highlighted on that home screen were, sure, the 13th and, you know, a couple others, but also like a comedy and a, you know, a romantic comedy, and you know, just to show the gamut, so that it wasn't just, you know, if you don't know about the oppression, here are the stories, here is, you know, here is what's the trauma, you know, to Sean's point, you know, it's kind of like, and so how do we, but also to Amber's point, kind of a combination of like, here are all the realities of Black life. I think that I'd be curious to see what the data would look like.
No, definitely. And the thing is, about all those shows that they show, those 6 shows, those are all Netflix produced shows. So of course they're getting more eyes on their own shows. And on top of that, yeah, you can learn about Black lives without it being like stories of suffering. You know, it could have been a comedy. You could say it could have been a sitcom there. It could have been anything with a Black main character who focuses on Black livelihood, right? So that's why shows like, you know, Insecure are so important right now, because it's like someone just living, a Black person being, and what happens with that, right? And you can learn just as much about Black lives in shows like that, right? Rather than simply this consistent form of trauma and educating on histories of hurt and violence, which are important as well, but there's more to that.
Can I add one thing to Adrien's point? I love brainstorming when it comes to reshaping the narrative or reframing the narrative and adding more perspective to representation, which I'm a huge fan of Stuart Hall's work, and it speaks so much highly of why he was on this journey in the first place. Anyone thought about looking at the role of blogging and how that has been used as a medium to shift the narrative from individual lives to group lives, societal lives? I often tell students that people will tell a camera all of their business before they tell another person, and there's a reason for it, because the camera doesn't talk back. So they're able to be authentic, honest, and they're actually able to capture their realistic experiences. And seeing how phrases like the day in the life of a UT student, or the day in the life of a person who lives in Ghana or anywhere else in the African diaspora area kind of helps people to reshape and look at ways visual narratives are in fact elements of evolving the concept of poverty porn, and how it can be a counter narrative to, or at least a counter tool approach to sort of combat those existing challenges within those spaces, because language, culture, and identification gives power to multiple people to provide an outlook as to where people are getting their information from, and also who's controlling it, and at the same time, the ownership of these experiences, and how it doesn't have to be subjected to commoditization just to be seen, but rather this is just me being visible and being diverse in so many other ways than what mainstream media has put together.
Or a white rescue gaze.
Yeah, absolutely.
Just try to combat that often.
Yeah.
Work, like, you don't have to be a savior. Just put people forth who are the experts, and we're good.
Yeah. All right, so we are at 12:29, and I think we go till 12:45. So I want to reserve the last 15 minutes to focus on some of these questions that have popped up from students and some other faculty. So there is a student asking a question here, and I'm thinking maybe that this might be a question for Amber and maybe for Adrien and Sean. It's a question about qualitative methods, and it says, do you think that the best approach to understand cultural nuances from a research standpoint is to consider qualitative methods and then further honing messaging and media based on insights from these in-depth conversations? I know you have some thoughts.
Go ahead, Amber. You go ahead and speak.
So I'll just say, at least from a practice standpoint, one of the things that I'm advocating for in the agency is that we use our tools that we have access to in order to get better secondary research first, and that we diversify where we pull secondary research, and that I'm turning some of our global intelligence research studio work towards academic spaces in order to pull some of that secondary research. The other thing that we have access to, which is a little hybrid of secondary and primary, is our social listening tool, where we can go in and really hear from the people what they're saying and pull that into the data to help us understand foundationally where we are. So my point of view, at least in agency work, in the practice world, when it comes to research, is to really let's do a full sweep of what we can and what's out there, and also really hear from the consumer segments we're really interested in and what they're putting out in the world, and then consider how that might impact our research agenda for the brand.
So you'll cast your net widely. What secondary research resources do you often turn to?
So it becomes like those that are already doing a lot of syndicated data at this point. Like you're looking at like Forrester, brand or groups and organizations like Iconoculture or Gartner, Global Web Index. Not only are they actually collecting a lot of data from surveys, but they're also turning around and doing reporting on the data, but they provide you the foundations of the data that they pulled, so you can kind of decide how good it is. I'm the only one nerding out that far, but but it's basically syndicated data. There is some resistance at the agency level with some of the academic sources, because some of them are very, very expensive, like a lot more expensive than they should be, but still trying to do that push, because there is more of a lot of our clients now, because of everything that's going on, they're looking for foundational research, whereas before they were more interested in trends. They're now more interested in like knowing why, what were the happenings, the historical foundations for why things are the way that they are, and for brands to respond.
Yeah. Do you guys ever use Mintel?
Oh yeah, sorry. Yeah, we have that's one of our big partners. In fact, we're trying to get them to sponsor our Marketing Ethnic Faculty Association conference. But yes,
excellent, because we're still using that in the research class. So just wanted you to give a shout out to that.
Mintel is life. Yes.
Yeah. Okay.
Awesome. Lots of good stuff.
Thank you. All right. So, Sean, qualitative research.
I'm going to be biased. Yes, it is an excellent way to make sense of individual groups or societal experiences through conversation, description, and examples that will take a researcher beyond their initial impression to different areas where they don't necessarily have control, but they're in a sacred space of taking these experiences and try to make sense of them through a strategic way that captures what I call the essence of their experiences, to provide some context to areas that may need more explanation than others. So I'm a huge fan of focus groups and interviews, particularly more focus groups, because it allows people to open up a little bit more succinctly together when they have something in common. But at the same time, you're developing relationships with members who you're working with. You're not just simply taking data, but you're also providing them an outlet to where they can seek more resources, understanding, and other things. So it's a balanced approach to answering questions, but also building relationships with people who you're working with. So it's I'm a huge advocate of that.
Okay. All right, good. So I'm gonna keep going with the Q&As unless anybody felt like they needed to. Adrien, did you want to add anything to that?
Yes, and this kind of combines that question on qualitative with a question I believe Corey Morgan, like looking in the Q&A section.
Yeah, thanks.
On communities, yeah, like how to talk to communities, right? And from a media standpoint, especially like SVOD, like a larger, you know, really worldwide, but speaking on just a nation-based medium, these are multi-billion, million-dollar companies, so they have the abilities to do these things. So I think what can be done and should be done really is the same way in which they, you know, I'll use Netflix as a bigger example again, because they're the ones kind of killing it in this SVOD programming and really kind of the model in some ways. The way they all kind of made everyone watch that one screen before they sign in, they can do the same thing with a matter of like focus questions or, you know, spaces in which they can talk about, you know, what it is that we want to see as consumers of this medium. What is it we want to see? What can be fixed in this particular platform, all these things. And that could be a simple, you know, 3 to 4 question thing with an open space for writing. And honestly, there's so many divisions in Netflix that, you know, this can easily be one and that could be paid for, right? So little things like that contribute to them being a space that speaks to the masses who are consuming them, and to kind of care to what is being consumed. I think in a way that, you know, HBO Max, that I was mentioning that the educational forum they had, and like explaining about the history of this film and why it should be read in this particular context, that can continue to be done in that way, especially with these larger companies. And I even found out about one yesterday. I put it in the chat right now, that there's this documentary on HBO Max called Black Art in the Absence of Light. And they actually have a art curriculum as well as like an art making toolkit that comes along with, that you can fill out yourself as PDF along with watching the documentary. So forums like these that are kind of engaging with the actual viewer outside of simply just watching and consuming in that way, I think those are ways to kind of speak to the community and also speak to what it is that these audience members are trying to seek from this media, because media is a form of pedagogy and a form of teaching and learning, but how can we take what we're learning here and apply it elsewhere? Or how do we know that what we're learning here is actually, you are going to change some of the things based off what we desire. So I think these companies, outside of like the Nielsen ratings that, like, you know, rate people are watching things, these companies of themselves need to have their own wings of how are they using qualitative analysis to change and better their own platforms.
Mm-hmm. Corey, what were you going to say? Were you going to say something, Corey?
No, but I just basically agree with Professor Sebro's point.
Okay. I swear I thought I saw a hand go up. Your hand.
I was gonna follow up on, because I think part of the question that both Corey's asked was about like, well, how do you talk to somebody without making it seem like you expect them to speak for their entire community's experience?
Yeah.
And I teach a multicultural and audiences class here at UT. And so Amber, one of the things I appreciate is you keep talking about experiences. And the first assignment I ask the students to do is, one, go and do some research on the history of a particular audience, and then find someone in your sphere of influence who you've probably never really had a real conversation with about their experience, and just ask them about them, right? Don't ask them to speak on behalf of their entire community. Just ask them about how they see it. How do they see themselves portrayed in media and advertising? What resonates with them? What would they like to never ever see again? What would they like to see differently? And then take a moment to reflect, like, what did you think this person was gonna say? Where did those assumptions come from? What things were you right about and what things were you really, really wrong about? And how do your experiences compare? And I think just asking people about their experience and being able to reconcile that experience, because you've learned something about the history as opposed to like what you know in the moment, helps. People don't have this pressure to feel like they're being the voice of an entire community, But the more people you talk to, the more you can find what's common, right? And where there are differences, what in their individual experiences versus what in their historical experiences might explain those differences and help you understand without the lens of what you think should be or how you've understood it so far.
And that's excellent. And it's an excellent practice for people who are trying to actually learn how to properly do research. And in executing and thinking about even the mindset that you're coming into and the approach. When I did some interviews recently, I always had to come back to, don't consider what you think everybody else does. Let's focus on you. You know, what do you think? What do you believe? But then actually having that muscle memory to consider that you need to do that all the time, even as you're guiding people through research. That's so important.
All right, so Amber, there's a question for you from Mimi, and she said, Amber, you mentioned that your company is undergoing a transformation in terms of issues around race. What's being done and what do you think seems to be working?
Well, I think the main thing that we wanted to do was to think about as an agency what it means to not just think about what inclusion looks like by the time we get to the execution process, the execution of a campaign, you know, because prior to, we would often have clients come to us and say like, all right, well, how can we make the ad more diverse? We need to make sure we have representation of the population in the ad. And, you know, I was not always happy about it, but I was often in a position to say, why? Do we have evidence that actual visual representation is useful for the goals that you're trying to achieve? Well, I just thought that's what I had to do. Okay. So when we're talking about process, I think the thing at the agency is like sort of doubling down on the process of how we work as an agency and determining that we are going to be inclusive from the start. So that means that when we're talking about business strategy and we're thinking about what's really important for a brand and what goals that they're trying to achieve, are we including all segments of interest in that conversation at the business strategy stage? If we're doing that, then are we including the appropriate segments of interest when it comes to research in determining what is the distance between what our brand wants to do and what our segments care about? Like, we have to make sure we're closing that gap. And then as we move forth and we move along, that means that we have the proper insights to make sure that we're making the right decisions all the way through, not just at the execution stage, but starting from the insight, brand building, business strategy stage, all the way down through production. And so what's really helping is that we are not doing anything different than we say we're doing in the first place. We're just putting some fine-tuned markers on how we make that process more inclusive, from the people who are working on it to the business strategy, all the way down to creative execution. And so in that way, we're getting to a place where when we're talking about creative and storytelling, we're saying, now, does it look like a Black person would live in that house? Is that how it would go around the dinner table? Would this Black mom really be chasing her Black child around the table trying to make her eat broccoli? Is that how that goes? No. So when we're talking about inclusive, marketing or being inclusive marketers at the agency, it's a lot easier to actually point people to the fact of business process and how if we make those changes in our business processes and how we execute, even who we partner with, supplier diversity, those kinds of things, it's a lot easier to pull through in the agency. They see themselves in it, they connect to it, and it's also easier for the clients to see as well. So we've been in this process for about 8 months now, and some of it is starting to flow through, but those are the things that make the real difference, is really making the effort at the business level and pulling it all the way through. Thanks, Mimi.
All right, so Sean, there is a question for you in the Q&A, and I'm just going to have you type an answer to that because I think it's time to wrap things up here. It's a question about whether Black newspapers are, okay, good. So I just want to, we're on time now, so it's the end of our class session. So I just want to thank our panelists and our respondents for coming today. This was just as wonderful as I thought it would be, and what a wonderful group we had. Thank you so much for showing up and for really giving us all of your insights and responses. And this was just a really magical hour and 15 minutes. Thank you so much for coming. And this was really great.